It gives me great pleasure to be here on this occasion for the launching of the legislative network for universal health coverage. This platform is indeed remarkable as it aims to strengthen institutional cooperation to advance legislative activities on health matters. Before I go further, let me particularly congratulate and commend the State Assembly members who are here. Your large presence here sends a very strong message to the country on your commitment to cooperation with the National Assembly. Your presence here also sends a very strong message on our commitment to this universal health coverage that we're all trying to achieve. The importance of this framework cannot be overstated, as our major role as legislators is to promote the welfare of our citizens. It is on us to ensure that effective healthcare systems are available to all Nigerians. These inform the desire to join the cooperative efforts of both the national and state assemblies targeted at developing health strategies that will work effectively for all. This, for me, is another rare opportunity for us to ensure that the legislative effort in both the national and state assemblies are moving towards the same direction. I therefore commend the respective chairman of the Senate and House Committees on Health for uniting with leadership of the health committees of the state to create this legislative network for universal health coverage with the support of the Health Governance Group of USAID and other development partners. As it is said, the healthy nation is a wealthy nation. In our efforts to revive the wealth of our nation, the health of our people must remain paramount. We must therefore strive to situate our health resources to optimally serve our population. As a nation, we have opted to adopt the universal health coverage, which seeks to ensure that all people obtain health services they need without suffering financial hardship when paying for them. The poor access to good health care in our country, especially in the rural areas, is a challenge we must tackle through innovative thinking and dedication. Going by the World Bank report, the state of the Nigerian health system is grossly underfunded with a per capita expenditure of $9.5. Therefore, addressing the issues in financing healthcare in a sustainable manner to reach all Nigerians call for the harmonization of legislative actions at both the state and national level. While the overall objective of the summit is to launch the National Legislative Network on Universal Health Coverage, the specific objectives will enhance the knowledge base and understanding of strategies in the legislature towards achieving the goals of universal health coverage. Is this possible? I strongly believe that it is possible for us to achieve universal health coverage. It is the right of our people. We must achieve this. Unfortunately, others before us have not been able to do this. We must make the difference. Today's session is the first stage in this direction, in us ensuring that we do achieve universal health coverage. But to do that, this is why this session we will have to share ideas and to ask ourselves, what is the roadmap to achieve universal health coverage? As the chairman of the Senate Committee has mentioned, by my background, not only being a medical doctor, but having the opportunity and great honor to serve my state, this was one of the policies that we left on universal health coverage in providing health care to all. And at that time, when we started, the community we started in Kwara North, we partnered with the private sector, local and international, health insurance companies. We partner with developmental partners, and the independent insurers who were in the scheme were paying as low as 300 naira a year. And with this, they had access to all basic health care. And two things I observed happen. First of all, I think we sometimes underestimate the number of our citizens who don't even go to healthcare centers. One, because they can't afford it, and two, because they believe there are cheaper ways. We found out that once we got people on the scheme, the attendance at the healthcare centers went up by many folds. So first, the importance of universal health coverage is just not providing healthcare, it's also bringing out a lot of Nigerians today who are not even receiving any healthcare at all. And this is one of the observations we saw. Secondly, we found that there were a lot of people in the private sector who were ready to partner in this area. We found out that at that time, I don't know what it is now, it cost about 1,200 naira every year to ensure healthcare at the primary level. The state contributed about 400 naira per individual. The individual paid 300 and the insurance company paid the balance. And with this, the citizens could walk into any healthcare center, whether it was malaria, antenatal, whether it was tests on to treat hypertensive, etc. But we all agree that immunization as well. If you cover malaria, you cover immunization, you address antenatal, I think our country will be free out of most of the health issues. And that is why it is important, distinguished guests who are here this morning, that being here today is a very important stage in us addressing healthcare. We must be able to come out with a roadmap. How do we fund this exercise? And that is why I did ask the minister. I hope that we were able to come up with a budget that talks about what is the cost for us to be able to provide universal healthcare. When we have that budget, then we can now take the responsibilities. What amount is the state and the federal government? What's the amount is the federal government going to bear? What will the states bear? And our developmental partners and the private sector. To our developmental partners, I do hope that today and tomorrow give an opportunity to review their approaches into how to support universal healthcare. I have a strong view that we must move away from programs that tackle particular diseases. Either we're tackling TB, tomorrow we're tackling malaria, meningitis. I disagree. Let us have a universal approach to address what is required for the whole country. Let us pull all those things together. And that also applies to the federal government. Today, it's meningitis, tomorrow it's TB, HIV, etc. No. Let us pull all the funds in all the different agencies together and be able to put through a central pooling. Government does not have the best skills in managing things. What I think government should do is use those funds. Let us partner with people who will manage those health centers, who will ensure that drugs are in those health centers, who will ensure that treatment in those health centers. As long as we want to continue to have yearly budgets in those health centers, it's just going to be business for those governments, for those directors. With all due respect, Mr. We will not get there. I believe we need to sit down and design that roadmap that will ensure that government takes its hands out of the fund, of the utilization of the funds, let me put it that way, and provide the funding and let the developmental partners, the private sector, the insurance companies, the providers who are ready. I've seen this, has worked in Kwara State, and I know it can work in Nigeria if we have the political will to make it happen. I also want to talk on our impact in the National Assembly, and I want to commend the Deputy Chairman of the House of Representatives who have raised a very good point. I have given my views to the Minister, to the developmental partners, to the state assemblies. I believe we at the National Assembly also we have a lot to do. We have a lot to do to convince our colleagues of the importance of us ensuring accurate funding of the health sector. I have a great responsibility, not being the President of the Senate and Chair of the National Assembly. With my background, it will be very disappointing if at the end of my time we cannot ensure that we provide adequate funding of the health sector and see that we also ensure the implementation of the Health Act. Implementation of the Health Act, well, Mr. Minister, we have passed the law. Implementation of the law is that of the executive. So we hope when you bring the 2018 budget, you will obey the law and ensure that 1% of CFI is there in primary health care. When you bring it to us, we will protect it. That is what I guarantee. And I'm not only speaking to you, so unfortunately the Minister of Budget is not here. I hope wherever he and the Minister of State are, the message is clear. When you bring that 2018 budget, do not break the law. Obey the law and ensure that the 1% of safe housing. For the State Assembly members who are here, I would like you at the end of this interview to go back with renewed vigor to see that community health insurance, universal health care in your state, and whatever laws that we need to pass. There are many examples of a few states, including ours, who have implemented this. Let us be able to go back to our states, because as the Minister said, it is not really the responsibility of federal anymore. It is the responsibility of the states. When your presence here shows your commitment in that direction, and I wish you luck in doing that. At this point, let me wish you all a successful deliberations on this very important issue. And at this point, ladies and gentlemen, I formally invite you to join me and in partnership as we unlock the pathway to universal health coverage in Nigeria and the launching of a legislative network that will ensure universal health coverage. I thank you and God bless.
And have this type of meeting is a great day for this country. And I want to thank Chairman and members of the Senate Committee on Health for putting this together. And to all those who worked hard to ensure that it is holding today. Secondly, it has brought together people from across the country. My struggle over the years is that we need to change the narrative. Health is not an exclusive responsibility of federal government. It is a national responsibility. When there is fever or cough in Ekiti, Abia, Niger, it is not the Federal Ministry of Health that should be responsible. The state must take responsibility. We need to work together to get things done. And I'm happy there are representatives from across the country here today. Thirdly, we are changing the narrative that health is not an item of expenditure. It's a critical factor for socioeconomic development. Your Excellency, when we invest $1 in infrastructure, the return on investment is $3. When we invest $1 in immunization, the return on investment is $16. When we invest $1 in TB, the return on investment is $85. So there is more to gain from investing in health than investing in any other sector. Your Excellency, as a doctor, this is the way to put our money. Without a healthy workforce, we can't build roads, we can't build railways, we can't go into mining, we cannot go to farm. No one will stay in school. So health is critical. And to me, this is the most important message I have to give today. And lastly, Your Excellency, the APC manifesto has nothing to it than universal coverage. And so delivering on this is delivering the manifesto of the party that you belong to. Your Excellency, there is no greater time to do so now than today. And lastly, it is a win-win. When Cameron wanted to win election in UK, he invested in the National Service. Theresa May did hers half-heartedly. A few weeks to the election, she said, oh, I will put money in mental health and so on. It was half-hearted, and the result was also half-hearted. Cameroon won massively. When you put money in health, the people will vote for our legislators, our governors, our president, the people will vote. So let's put the money there and the votes will roll in.
Minutes at the back for plenary. Thank you so much. Yes.
Greatest honor to, I'm told, unlock challenges that will ensure universal health coverage in Nigeria.
Photo opportunity, please can I have members? Thank you. We're witnessing history here today, and as the Senate President has spoken, that it is a collaborative effort that will bring the realization of what we are doing here today to form. Please, can we all applaud ourselves? Says it is a commitment from everyone. Distinguished Senator Dr. Abubakar Bukola Saraki to launch the legislative network for universal health coverage.
Thank you. Please be seated. Thank you.
And then to set that up for the next slide is also related to poverty. Next slide, next slide. You'll be in the notice. They have the post-maternal. So tomorrow we start this program of vaccinated fine with the infant mortality, the under-5 mortality, but we are not done with the maternal mortality. And that's why tomorrow we will begin start a program of vaccinated reduction of maternal mortality in 5 states, 6 states in the country. The 6 states with the worst maternal,
Which I've said will double, and we need to work on that population so that we can make things work for ourselves. Next slide. And that we have to look at the population, the total fertility rate for different parts of the country, trying to compare Nigeria with Indonesia, where, although we started around the same place, Indonesia today is at 2, Nigeria is still at 5.5. Next slide. And this is also looking at the various rates and really talking about what we need to do as a country to make sure that things improve. Next slide.
Set policy in motion for maternal health care and now for universal health access.
Thank you so much, Wuji, for your introductory remark.
Is the Honorable Minister of Health, Professor Isaac Adewale, but to make best of what he's doing. Yeah, okay. You have displayed your passion and commitment to improving the health sector. We're there, the roadmap.
Baseline is at least 7.5%. That is number one. Number two, Your Excellency, we are yet to implement the 1% CFR of Consolidated Revenue Fund. There's also no better time than us to do this than now. 3 years after this law was signed, it was never implemented. It will be a great service to the health community, to the people of Nigeria, if under your able leadership, you are able to achieve this 1%. Let me say that health today is in a critical situation. We have so many challenges. In fact, very soon, within the next 3 years, Gavi, Global Alliance for Vaccine and Immunization, will be withdrawing from Nigeria. By that withdrawal, Nigeria is expected to be contributing from the year 2022 the sum of 461 million US dollars. If you multiply that by our current exchange rate of 305 naira, it will mean we'll be requiring the sum of about 140 billion naira just for immunization. It means we have a lot of things, you see, really to achieve. On this note, I want to thank everyone for coming, civil society organizations and other critical stakeholders in the health sector here present, gentlemen of the Senate, our distinguished senators, my colleagues, honorable members of the National Assembly.
Speakers represented by the Speaker, Kwara State House of Assembly, Right Honorable Dr. Ali Ahmed, who has made us proud from the Ivory.
And per capita public health expenditure, implement the Abuja Declaration of allocating 50% of national budgets to health, and foster intersectoral collaborate with development partners and technocrats to explore and develop policy options for affordable medical care and services for all, strengthen the national health financing system.
The situation in Nigeria is similar to many developing countries, with an estimated population of over 182 million. Only a small percentage of its population is covered by the National Health Insurance Scheme from public health risks and to protect all people from impoverishment due to illness, whether from out-of-pocket payments for healthcare or loss of income when a household member falls ill. In 2005, in its resolution on sustainable health financing to providing accessible and affordable health interventions for all, the World Health Sustainable Finance of the health system. However, His Excellency Distinguished Senator Dr. Abubakar Bukola Saraki, can you permit me to stand on already existing protocol?
And children not only have an opportunity to life, but also have quality life. So on behalf of the Bill and Melinda Gates Foundation, sir, I would want to once again congratulate you. And I was going to complain that
morning. It's a pleasure to be here. Honorable President of the Senate, Honorable Speaker of the House of Representatives.
We welcome her. And it's exciting that it's a woman, because the health needs of women, messages. You'll recall that Senator Teju Osho spoke to the fact that we're here today because he took on this new responsibility as distinguished senator. Thank you again, Senator Teju Osho. Shall we please appreciate him one more time? The young man is an achiever. You recall that as commissioner in Ogun State, Dr. Olariwaju Teju Osho, who is also the chairman, said it now, will be sustainable and move us ahead in the health sector. Without while we're still
launch to create a legislative network for universal health coverage in Nigeria. I congratulate the government's leadership convening this summit, which marks a critical step to bridge the gaps to deliver life-saving health interventions and ensure that all Nigerians have access to affordable, quality health care. The legislative network you are launching today promises to leverage support for health financing necessary to achieve universal health coverage. The network will provide specific information to all parliamentarians on establishing universal health coverage and delineate the roles they can play in providing support. Parliamentarians from across the country will receive valuable information to make strategic healthcare decisions. This summit is an important milestone in Nigeria's quest for universal health coverage. It paves the way to build a network that will increase understanding of the nuances of appropriating healthcare funds under the Basic Healthcare Provision Fund, elaborate on the parameters of financing and implementing universal healthcare, and place healthcare at the forefront of the legislative agenda. We understand that this is a time of economic difficulty in Nigeria. No government must weigh competing priorities when making budget allocations. The government must weigh competing priorities when making budget allocations. But we believe that investments to strengthening the health sector are pivotal for building human capital, which is a country's greatest resource. A stronger health system not only reduces the cost burden of disease in Nigeria's high maternal and child mortality rates, but also ensures a strong workforce for a productive economy. In the long run, strategic investments in health will yield significant demographic dividends across the board. USAID has partnered with Nigeria's health sector for many years. One of our principal activities, the Health Finance and Governance activity, has helped establish the legislative network for universal health coverage and will help the network become a strong advocate for improving health systems across Nigeria. In closing, I would like to reiterate that a healthy population is a key factor for Nigeria to achieve its vision of economic and social prosperity. We wish the government of Nigeria continued success building a healthy nation through universal health coverage. Thank you so much.
Experiencing financial hardship. Universal health coverage will not only improve the state of health of citizens and burden of disease borne by the country, it is also an economic, social, and political imperative. To demonstrate Nigeria's commitment to the principle of universal health care, the last administration convened a presidential summit on universal health care to deliberate and chart a course of action on universal health care for the country. The present administration of President Muhammadu Buhari has continued this stride by unveiling the revitalization of primary health care for universal health care as a main health policy thrust. However, universal health coverage agenda requires concerted efforts from all arms of government, including the legislature at both national and state levels, to fast-track Nigeria's universal health coverage aspirations. The Senate is currently undertaking the major revision of the National Health Insurance Scheme Act. We hope to assure every Nigerian affordable and quality health care by the time we finish the revision of the Act. Across the democratic world, lawmakers play very important statutory functions that have huge implications for the design, implementation, financing, and raising accountability bar for social policy thrusts, including universal health coverage agenda. The legislature's statutory functions of appropriation, legislation, accountability, oversight, and representation are needed to create necessary legal frameworks, mobilize additional public funds, and hold the system accountable to ensure high-quality design and effective implementation of universal health coverage mechanisms. While there are ongoing pockets of health-related efforts by national and state lawmakers, the Senate Committee on Health, in collaboration with development partners, have resolved to institute a legislative network on universal health coverage to harness and align the roles of lawmakers towards advancing universal health coverage costs and serve as a veritable tool for coordination and learning among federal and state lawmakers. The objectives of setting up the network, among other things, include improved appropriation to health sector by deepening the knowledge of lawmakers on economic, social, health, and political benefits of improved health funding towards universal health coverage. Ensure prompt and adequate release of allocated funds by working with the lawmakers to make relevant central budget agencies accountable for fund release. Ensure timely passage of relevant high-quality health laws, especially the legal framework for National Health Insurance Scheme and state-supported health insurance schemes. Other objectives include leveraging the oversight and accountability functions of the lawmakers to assess and improve quality and efficiency of implemented health projects, irrespective of the funding sources. To also gauge citizen satisfaction on health service delivery and performance of specific health schemes, and enhance sustained learning among lawmakers across states and between state lawmakers and their federal counterparts. The proposed legislative network on universal health coverage holds the key for unlocking national potential for achieving universal health coverage and serves as an example for other developing countries to emulate in their quest to expand access to quality health care. If the objective of the network is achieved, it will serve as a model for strengthening democratic institutions to leverage their statutory roles in expanding access to social goods and services, including education, nutrition, water, and housing, which are also important determinants of health. The legislative network on universal health coverage will be unveiled today by the leadership of the National Assembly, led by His Excellency, the Senate President, Dr. Abubakar Bukola Saraki. All hands are on deck to ensure that the network does not end with its inauguration today, as the course of action for operationalizing it will be charted and the performance framework for measuring success will be agreed upon. Like most laudable causes, the path to bringing the objectives of the legislative network on universal health coverage to fruition will be paved with challenges. But if the vision is backed with consensus, building, and unallowed commitment, it can only end as a success story for Nigeria's health sector. I would also like to add that we realize that the President of the National Assembly, Chairman of the National Assembly, and President of the Senate is a very successful medical practitioner. And he's very passionate that during his time as the President of the Senate, the health sector of Nigeria will never be the same. And most importantly, the Chairman the chairman of the Senate Health Committee, myself, I'm also a medical practitioner. I'm also a medical practitioner, and it is a big challenge for us that if we cannot get it right at this time, I don't know how we can get it right. So I thank His Excellency for his passion for the success of the health sector in Nigeria. I also thank our development partners for their support. They made this possible for us today. We thank you very much. Once again, distinguished guests, Your Excellency, ladies and gentlemen, I thank you for listening.